So welcome back, everyone. I'm excited to be here, and we're networking with everybody. We're live on Facebook, so hi to everybody out there. Like us and follow us. We're going to share the show later on. Insurance and benefits specialist I have with me, and we're going to talk with the Howard Farkash Agency. Welcome back to the show. Howard, you have been on my show for over 5 years, and we have talked a lot about different insurance products and things like that. We're going to kind of go into the things that you want to talk about today, but I do have to say something about you, if that's okay.
All right, Ed.
Okay. Howard is probably the most meticulous person I've ever met in my entire life, and if you ever have a question when it comes to insurance and benefits, he is the person to talk to. And there's a reason why. When you have a question, he's going to make sure that you get a answer that you're going to understand.
Well, thank you. That was very kind of you. Yes, I'm Howard Farkash of the Howard Farkash Agency, and I've been working with insurance here now in Phoenix, Arizona ever since about 1998. Prior to that, I did work in the upper Midwest. I came out here to assist my parents with their retirement and liked it, decided to stay, and here I am some 20-some odd years past that point in time. My agency is built around taking care of people's benefits as they transition from work to retirement, basically. And we also help those people's children and grandchildren with their benefits programs just as well. Today I want to spend considerable time on Medicare. We're approaching the Medicare season, which will start in late September, early October, and run through the balance of the year. And I think it might be appropriate to take a 30,000-foot view of what Medicare is all about. When you go on Medicare, you have three choices. You can take just the original Medicare itself, which was initiated back in 1965, and whereby you're insured by the United States government. Or you can add to that a Medigap policy, a supplemental policy to cover what original Medicare doesn't cover itself. Or you can have a Medicare Advantage plan, which is actually it's supervised by the United States government, but your whole insurance plan is actually privatized, basically, with the various insurance carriers. So basic Medicare, as I started out to say, there's little to say about it that's really favorable, because it only covers 80% of your benefits, of your bills, basically. That's all. There's no prescription drug coverage either. You pay full retail for your prescriptions, and you pay or cover the other 20% of your doctors, hospital, surgical therapies, and chemotherapy kind of bills. So it's not a good choice. So in reality, you have two choices to make, two good choices to make, a Medigap policy or a Medicare Advantage policy. Now, by design, both types of plans are workable. Some sales and broker personnel will say that they are the same. They are similar, but different. And to a certain extent, it's like choosing between a Ford and a Chevy of similar size with similar but different equipment. Some people will take one over the other for very different and very specific individual differences, basically. The important thing is to know you have the two choices and the differences in the two types, what those differences are. Because of the nature of marketing and the extremely high profitability of Advantage plans to the insurance carriers, Advantage plans are often deceptively advertised and promoted to consumers, many of whom have little understanding of how health insurance works. The key to making the right choice for you is to be completely advised on both sides of the key question, original Medicare with Medigap or Medicare Advantage. It's your choice. Don't let any broker, agent, or telemarketer take that choice away from you. I have met many people who are on Advantage plans who are never advised there are also Medigap plans. That's because sales agents and brokers receive about twice the compensation for an Advantage enrollment as opposed to a Medigap enrollment. Incidentally, 80 to 85% of my clients are on the Medigap plans. So you can see I give myself a good raise by pushing and steering people into Medicare Advantage. I don't do that. Advantage plans are heavily advertised as being equal to or the same as Medigap. And some could even say they're better. Yes, on paper you can argue they cover the same things, but it's how they operate, no pun intended, that provides the basis for making your choice. let's take a look at how these plans operate. When it comes to doctors and hospital access, Medigap plans, you can go to any doctor or hospital in the United States that accepts Medicare, which is well over 90% of the doctors servicing the senior population. There are no network restrictions. There are no referrals needed to go to specialists. There is no prior authorization required. Your doctor calls the shots, and again, that's no pun intended, but he calls the shots. With a Medicare Advantage plan, that's different. Mostly, Medicare Advantage plans are network-based because they are essentially HMOs or PPOs. Now, you must be aware when you're dealing with an HMO or PPO that they have networks, but sometimes they're ghost networks. They just aren't as full as they appear on paper. You may need to use in-network providers. Well, you have to use in-network providers. On most plans, out-of-network is not covered at all. Referrals to specialists may be required. So, treatments and procedures for care may be and often are subject to prior insurance carrier approvals. Delay and deny. In an earlier broadcast, Carol mentioned she just had a hip replacement. My brother recently had a hip replacement also. When my brother's doctor said you need a hip replacement, his Medicare Advantage insurance company said, well, we'll give you a partial, not a complete hip replacement. So he had his partial, he had physical therapy after, and now he can't bend down and pick up a piece of paper off the floor. Carol, I predict with your Medicare supplement plan, you're going to be able to pick papers up off the floor.
But thank you for that.
Okay, well, let's talk about costs. Medigap policies, they are different, by the way. Medigap plans and Medicare Advantage plans are different when it comes to cost. Under either type of plan, you have to pay your basic Medicare fee, which is $185 per month. If you make a lot more money than that, you'll pay a surcharge, and that surcharges start when you make $106,000 as a single filer or $212,000 as a married couple. But when you get into Medigap policies, they have an additional premium, and those premiums start at $37 and run up to about $89 per month for a Medigap policy. It depends on your age, your gender, your zip code, and the plan selection. And every year you take a price increase because you've gotten older. You also have a Part D. D is for drugs when you're in Medigap. When you're doing drugs in Medigap, you'll wind up with paying a premium for your drug coverage, and that's an additional $0 to $140 a month. Once again, depends upon what drugs you are taking as to what drug plan you will select. Now, when it comes to Medicare Advantage plans, there is no additional premium. There's still that $185 I spoke about, but there's no additional premium for you to be concerned about. Or very few, actually, Medicare Advantages actually have a premium. Now, you must remember something else. There are usually no deductibles in Medicare Advantage plans, and they have a maximum out of pocket. So you don't have a premium to pay. You don't have a premium to pay every single month for the Medicare Advantage plans, but you do have to pay for services as you use them. There's a service for virtually all the services, and that goes by what is referred to as coding. So that's how that works, basically. And you will also have a copay to make just along the way as you are progressing through that. Medicare Advantage, as I said, do not pay an additional premium, but they do have the follow-up copays that you'll be responsible for. And you are protected with an out-of-pocket maximum.
We're going to go to a break, and when we come back, I want to talk further about all of this, because you know what, when it comes to Medicare, and you've been doing it since what year?
Oh, 1998.
1998. He knows everything about Medicare,
And
especially.
I'm on Medicare too.
And yes, he is. And you can just call Howard at 602-909-8433. It is a free service to you. It just makes sense to speak to somebody local, especially if you're, now you're a senior, having somebody who's walks in your shoes, right? And knows this inside and out. And what I love about Howard the most is when you have a question, you will get a very long answer that will be very easy to understand, because he wants to make you understand what you're doing. It's a total difference than just having somebody get you into a plan.
And we're just about halfway through on this segment, basically, and you see how complex it is. Don't try to do this yourself. Call somebody such as myself, but somebody who knows what they're doing, been at it for a long time, and can get you into the right plan for yourself.
Just call Howard. His phone number is 602, sorry, 602-909-8433. That's 602-909-8433. It is a free service to you. It does make sense to, having people here and having somebody that you can talk to that's local, so important. Again, write this number down and just call Howard at 602-909-8433.
Thank you, Carol.
We're still live.
Really?
We're still live.
I know that.
Come on over here. It is the wrong ad.
I took care of it. We got brand new computers
Okay,
recently.
put right there, it doesn't matter.
Alright.
Make sure if you do that for me and put that on again right now for his.
Yeah, we can do that. But I took care of it. It won't happen again.
Okay, thanks.
Yeah.
Go ahead. I took care of it.
No, we're fine. Everything is fine. We're doing well. I want to get through.
So now, when we come back, where are you? So I know where I'm at. Because I got a different whole deal.
No, all you have is one page of
Right.
this whole.
So you tell me where you're at on yours.
You'll hear it.
You'll hear
This
it?
is your clue line.
Okay,
So
that's
Carol,
mine?
what are some of those
Okay,
questions?
okay,
Yeah.
got it. I got it.
Many times. He's a
Okay.
trusted business coach with a proven system. Now he's launching something just for small business owners. His small
Alright, it's all good. I took it out. I don't know why that got in there, but it
Well,
won't happen.
you might need it down the line for something else.
I have the backup of it,
And
but
it's
Yeah, okay.
no blood,
Thanks.
no blood, no foul.
today at 602-820-6978 or visit healday.com. Are you concerned about having enough money for retirement but sick of hearing the same old advice?
I think I know where I want to go. I'm gonna have to shorten this on the fly.
We use innovative income strategies.
I think I know where I want to go, so I'm gonna just shorten this on the fly.
Okay.
We should do an hour sometime. We might
That's my
do-
next question.
We might do an hour sometime. We might do an hour.
Well, you might want to getting closer to your season.
Yes, that's what I'm thinking.
Yeah.
Yes.
Anyway, I gotta talk to you about the dates anyway.
You want what?
I have to talk to you about dates anyway.
Okay.
What's wrong with my voice? I don't know. It does it a lot.
I'll do an hour with you. I can't hear anymore. I can't hear you.
Don't worry, I'm not talking to you.
Okay.
Don't change it. Does it now? You're gonna put his on? Okay.
Saying Enterprises, we don't just sell.
That's not it yet.
Silver, we ensure that you
Okay.
are prepared to thrive in any economy. Driven by our passion for education, we empower you to achieve financial freedom and independence through sound money principles and community. Call 480-376-7456. That's 480-376-7456 or visit us at LynetteZang.com.
Life is full of moments we cherish, moments that deserve
This
to
is
be
your-
protected. At the Howard
They put a
Farkash
wrong
Agency,
Howard in there.
We believe that protecting what matters most should be simple and stress-free. For the future you want to enjoy, our
There you go.
long-term
See?
coverage solutions can help you stay comfortable and secure, no matter what life brings your way. Protect your life, protect your future. Just call Howard at 602-909-8433, 602-909-8433. He'll be glad you did.
So welcome back, everyone. We are talking with Howard Farkash, and we are talking about Medicare. And you happen to specialize in Medicare, and there's so many parts to it.
Oh, absolutely. We're not gonna talk about the parts, part A, part B, part C, part D, what's it all about? let's not spend our valuable time talking about that. What I wanna do is help people understand what they need to know about the plans and how they operate, so that they can make a wise decision for themselves when it comes time for them to select a plan. Quite often, the decision you make when you enter Medicare, or if you're switching plans, could last you for the rest of your life, basically. So it's something you should take some time with, understand it, and make thorough choices, and be sure the people you're working with, a broker or a sales agent, is willing to show you both sides of the coin. Because unfortunately, the choice sometimes is referred to as a devil or the deep blue sea kind of decision. I like parts of Medicare Advantage, I like parts of Medicare Supplement. Gee, how do I make up my mind? Well, you can make up your mind on what's most important to you, and that's how the plans operate. So when it comes to flexibility, Medicare Supplement plans are a lot more flexible in terms of letting you make choices as to where you get your care. A little less flexibility for the Medicare Advantage plans, but they are pretty good. You still get to choose your doctors because you choose them choosing a plan. If your doctors are probably not in all the plans that are offered, so you pick a plan where your doctors are members of that network. The Medicare Advantage plans do require network selection. You have to actually pick a specialist, a general doctor, and then ask for a referral. That's the word I was fishing for. You need a referral in order to go to a lot of your specialists, but even that is becoming easier under Medicare Advantage than it used to be. Under Medicare Supplement, that was never a problem. You could just go to any doctor, any referred doctor that you want to, or you didn't even necessarily need a referral. The doctor you're going to, the specialist you're going to, he may have wanted you to be referred by your general doctor, but it wasn't part of the plan. So those are some of the flexibilities that you have. Once again, that prior approval issue is raises its head. But on the other hand, and there's always another hand it seems, on the other hand, Medicare Advantage plans have tremendous amount of additional benefits, like preventive dental, or even sometimes there are plans that have very advanced dental services. Those are usually limited in how much service you can get, and you can pay extra for those services if you want them. For Medigap plans, you can purchase freestanding. You don't have that under Medigap, but you can purchase that as an add-on. And there's a lot of controversy as to whether eye care takes place under Medigap. It certainly does. Any pathology of the eye, glaucoma, macular degeneration, and all the other retinopathy, and all the other illnesses of the eye, those are covered under Medigap, as they are under Medicare Advantage. But Medicare Advantage is also a little more liberal and give you an allowance for glasses every so often, basically, depending upon the plan. So there are advantages. Do we talk about quote-unquote free rides to your providers, to your doctors, basically? You're older, you can't get out, you don't drive, or you become disabled because of age, or an accident, or an illness. 24, during the course of the year, you might get 24 doctor's rides, and rides to the doctor, basically. Waymo, Uber, you get these kind of rides, or other kind of services are available to you, paid for by the insurance company. So there's a lot of good benefits there. Now, I can expose you more. You can see that I'm rushing to this point in time. I can expose you more if we have the time to work together, and that's where I offer what's called a concierge service. And during the concierge service, you're likely to ask a lot of questions. Carol, what are some of the questions that come up during concierge service?
Well, here's one that I was thinking about. Can you go to any doctor?
Well, yes, you can go to any doctor if you have a Medigap policy, and it'll be covered. That's assuming that the doctor takes Medicare, and that's well over 90% of the doctors who service senior population, basically. So you can, if you choose the Medicare, the Medigap kind of policy. If you take an Advantage type of policy, you'll have to go to doctors in network. If you go out of network, it may not be covered.
Well, I have another one here. Are there plans with no premiums?
Well, yes, there are. The Medicare Advantage plans, quite a few of them. In fact, most of them actually have zero premium.
So then here's one. Are there plans with $0 co-pays for doctors and, for the visits and all the labs and all of that? Do they have that?
Yes, as a matter of fact, you can get zero. Well, once you paid your premium on Medigap, you have zero to pay. Once you've met your deductible and paid your premium, I should say. well, then you're gonna be, you're not gonna be paying. It's like your doctor is your son, and the gal who runs the hospital is your daughter. They're not gonna charge dear old mom for the services, basically.
That's what you think.
So that's on the Medigap side. On the Medicare supplement side, on the Medicare supplement, no, on the Medicare Advantage side, you basically have zero premium for a lot of your doctor office visits, basically. Specialists do cost more, but your general doctor will not cost you a premium in most cases, a copay in most cases.
Can you help people know and predict their prescriptions costs?
Yes, as a matter of fact, that's one of the, being a somewhat of an analytical, that's one of the things I
He's
really.
great at it.
That's one of the things I really do enjoy. And there's actually, you could do it yourself if you want to, otherwise I can do it with you. And that is using a government-provided tool called the Plan Finder at Medicare.gov. You can actually predict what your costs are gonna be for next year based on the medications that you're taking at the present time.
How about this? Are there special plans for people with heart conditions or diabetes?
Oh, absolutely. That's an important part of Medicare just as well. Most of those take place in the Advantage side of the house, basically, but there are plans for people with cardiac problems or diabetes kind of conditions, and they make sure that you're being well taken care of.
Well, how about this too? Does a concierge service such as yours help people with renewing their plans?
Oh yes, another big important part is the fact when you're in Medicare Advantage, your plan will change year to year to year. You'll receive an annual notice of changes, and that ANOC, as we call it in the business, that ANOC will tell you what's changing in your plan, whether your doctors are going to be in the plan, continuing in the plan, or part of the review process I conduct with people is to verify that their doctors are going to remain in plan and that they're going to have the lowest cost prescription package they can possibly get, considering all the plans that are available, basically.
Well, I think it's wonderful what you do. It is a concierge service that you're offering for people out there that is a free service to you. It makes sense to speak to somebody who can help you understand everything, and when you have a question, he will make you understand it.
So when I mentioned the fact that this is a very complex issue, that what we reviewed, and I've noticed that time is running out, I could actually send you a complete summary of what we've talked about here today, just by giving me a call at 602-909-8433. And that's one thing I can do for you. It can also make you even more knowledgeable, because this was the 30,000-foot view. A book called Medicare Made 1, 2, 3 Easy is available to you. You can have that just by giving me a call. Once again, that number is 602-909-8433. Be happy to get that book in your hands. If you're looking for a broker, yeah, you can find me. You know the phone number. But if you're looking for other brokers and want to interview them and make sure that they know what they're talking about, I do have a guide to interviewing a broker, because essentially you're hiring a broker to do work for you, basically. If you were hiring employees or household help, well, you'd probably know a little bit about them just as well. So that's what my guide does here. My white paper on hiring a broker or interviewing a broker is available to you just as well. That magic number, 602-909-8433.
Now, he would love for you to interview him. So when you get the white paper, you can call him and you can use that to interview Howard. He would love you to do that. As well as if you would like to learn more about Medicare, he has the book Medicare Made 1, 2, 3 Easy. Call Howard at 602-909-8433. It is a free service to you. He calls it a concierge service to you. And when it comes to Medicare, a lot of people right now I mean, it's already July, and October is a big season for seniors.
Well, it is, and
It's around the corner.
one last bit of advice is go see your doctor now during the summer. Get your annual wellness examination completed, and if he changes your medication, you'll be ready for planning on next year's medications.
Just call Howard at 602-909-8433. He'd love for you to interview him, or you can use it to interview others. He's got his white paper that is an interview guide. You can also get his book. It's called Medicare Made 1, 2, 3 Easy. Just call Howard at 602-909-8433. And like he said, it's the summertime. Go to the doctors and make sure that you're healthy and get the right plan for you. It's all about that, folks. Again, that number to call him is 602-909-8433.
Thanks a lot, Carol. Good afternoon.